Well, welcome everyone. This is Dr. Waite. We are on to week 7. We are slowly but surely closing down the semester. So, this week we are going to evaluate the trunk and spinal column. So, this is the final piece of the body that we've been working on the last 6 weeks. So, this week we're in chapter 11 of the textbook, pages 329 through 366. For this week, you'll want to look at the PowerPoint that's provided online. It's a large PowerPoint because it's covering everything from the neck down to the hip, and basically the core of the body. We're going to be looking at the abdominal structures, the back muscles, and then the spinal column as well. Okay, so a lot of content to get through. So take your time with it. There are 3 tasks this week. You have your quiz 6, which is on the trunk and spinal column. This is our last quiz because next week will be week 8 and we'll have the final exam. So this is our last quiz. But you do have muscle chart number 5, which is on the spine and trunk. So make sure you fill out those. There are 3 of those. One for the spinal column itself, so the vertebrae, one for the abdominal region, and then one for the back muscle region. Okay, so make sure you all 3 of those completed and submitted, and then you have cap number 5 on the spine and trunk, which of course you know the caps are used to help prepare you for the final. All right, the testing content. Okay, so get in here early, take a look at it as always, and yeah, I'll go through the PowerPoint briefly with you. The PowerPoint starts off looking at the vertebrae, the vertebral column. There are 24 articulating vertebrae that we look at, and 31 pairs of spinal nerves going through those vertebrae. So a lot going on, of course, because the vertebrae is protecting the spinal column, which is where all neurons pass through, coming from the brain and innervate through the nerves to the muscles and scan and other tissue and tell us what to do and when to do it, and basically God's wonderful design of how we function. So very complex, and a lot going on. Muscles, there are a lot of muscles that are linked by fascia itself, and then tendons or bands of tendons, and a lot of them don't actually attach bone to bone. Most of them actually attach to small little muscles that are help controlling and stabilizing the spine. So most of the muscles you're going to look at in the spine are considered stabilizers. They're not like primary movers, but they help with some very important roles such as like respiration, breathing, okay, like the diaphragm muscles. Okay, all right, so bones, we'll look at those first in the column, the spinal column. So we have 7 cervical bones in the neck. The top ones being the atlas and axis, which allows us to rotate and bend well, and get range of motion. Then below the first 7, you then have 12 thoracic vertebrae. So the cervical, another name for those are the neck vertebrae. The thoracic are known as the chest vertebrae, because that's where the ribs connect to and form the rib cage, which form your chest, meet at the front with the sternum. And then we have 5 lumbar or lower back vertebrae. Okay, lumbar are discussed a lot because of slip disc and issues with the lower lumbar, due to lifestyle concerns like being overweight, lifting things improperly, injuring those areas. So those will be discussed quite a bit in some of the material from this week. And then below the lumbar, you actually have a few more bones to discuss. There are 5 sacrum bones that are basically fused together, that form basically the posterior aspect of the pelvis, where the ilium and ischium meet. And then below that you have the coccyx, which are anywhere from 3 to 5 bones, depending on the individual, Typically, it's 4 bones fused together. So if you ever heard the term your tailbone, that's your coccyx. It sits right below the sacrum. Technically, it's the bottom, the very, very bottom of the spinal column. Never grows and turns into a tail, but it's there. And anybody that's injured it knows it's there. So for the bones, the PowerPoint just goes through each one phase by phase, from the cervical to the thoracic to the lumbar, and then talks about the sacrum and the coccyx. The first two that are discussed, of course, are the atlas and axis. The atlas sits on top of the axis, allows it to rotate and basically get full range of motion. Not quite like an owl, we don't spin around, but it does allow us to get great range of motion from side to side. Yes, so take a look at those. The atlas and axis have a very unique structure. You'll see that in the images. It just has to do with where the transverse process and foramens are located and how muscles attach to them to help manipulate the spine, help us move. Some of the things that are also evaluated are excess curvatures of the spine, so like lordosis versus kyphosis and scoliosis. Okay, those are the 3 big ones that are looked at. So take a look at the differences between those deformities. Then when you look at the thoracic region, take a close look at the ribs, the role of the rib cage, the different joints that are there, the landmarks, and then it gets down towards the trunk region. Talks about the structure of the vertebrae joints themselves, the role of the intervertebral disc is really important to understand. There's some good images of the disc as well. Shows you some images of a disc that has been basically slipped, or the better term is herniated. Right, when the nucleus pulposus of the middle of the disc actually is released because of tearing of the disc, the cartilage material, and allowing it to slip out, which then causes the bulging on the nerve, ending typically like in the sciatic nerve that shoots down the legs. Not fun. All right, then he goes into movements of the spinal column. The big ones are flexion, extension of the trunk. Now, pay close attention to the movements, because flexion can occur just about anywhere. And when you look at spinal flexion, it's really collectively all vertebrae flexing to some degree. So it's kind of interesting. Now you can isolate flexion and extension in each of the joint regions, like cervical versus thoracic versus lumbar, but you can also do it collectively. So we can get a good amount of range of motion, but it's also limited range of motion. And then we also have lateral flexion. You can flex to the side, both left and right sides, to some degree. Yeah, and then there's a term called reduction, which we look at, which is turning the neck side to side. That's not lateral flexion. The term is called reduction. It's like cervical reduction. And then you have lumbar reduction. So it's, when you're just twisting at the lower lumbar. And those are isolated movements versus complete lateral flexion. Then there's rotation as well, because we can rotate the vertebrae. Okay. Then it starts to get into the muscles. There's a lot of muscles to look at. The primary ones you're going to get into once you get past the rector spinae and all the little spinalis muscles that connect to the spine. The big muscles are going to be, of course, the sternocleidomastoid and the splenius muscles for the spinal column. And then it gets into the abdominal muscles. Like you got your rectus abdominis, your external and internal obliques, and the quadratus lumborum. Okay, those are the big guys. So look at those, and it'll talk about the the thoracic region, stabilizing the spine, both anterior and posterior spinal muscles and what their roles are. Like the trapezius is involved in there. You also have the rectus capitis posterior, both major and minor, splenius capitis, semi-splenius capitis. There's a lot of them. Rector spinae, I mentioned that one. Yeah, and then those are all the superficial primary movers. Then it goes even deeper, so you have a whole row of deep muscles, which are the interspinales and the collis and the multifidus, the rotators, the even the psoas major and minor are discussed because they connect to the spinal column down near the lower lumbar and then go into the pelvis to help flex the hip or bring the femur up towards the spinal column. And then there's muscles of the thorax, so the diaphragm. Yeah, there's quite a few in there to take a look at. And again, I don't expect you to have all these memorized, but understand the functions of the superficial and deep muscles, where they're located, general location, and their general functions. Even I've studied these for many years, and I don't have them all memorized on exactly where they locate. That would be the role of a physician or someone who specializes in that area, which may be you someday. So if that is your goal, you want to be a surgeon or you want to be an anatomy instructor or work in the field of specializing the spine, then these would be muscles that you'd want to memorize more closely and understand their functions and so forth. But for the general kinesiology and pre-med student, just know the function and the roles of them and be able to identify where the muscles are located and how they apply to our movement ability. Okay. It goes into discussing core training and what that really means. Now, one piece of advice I'll give is when you hear the term core, it's not talking about just your rectus abdominis. It's not just the 6 or 8 pack. Okay, we're talking about collectively all the muscles that help to stabilize and manipulate the spinal column, as well as the hip flexors because they're connected to the spinal column. So when I think core, I think abdominal, back, and hip muscles. Anything attached to the hip, including your butt, right? Your big gluteal muscles, the little gluteal muscles, pectineus, TFL, all of those are involved in the core because you have to flex the hip and extend the hip to manipulate the trunk as well. They work together. So it goes into talking about the nerves, and then it gives you some really great detailed pictures of each muscle in pink. So go through each of those, identify them, and as you're working through the PowerPoint, also work through your muscle sheet. So as you go through each slide, it gives you the answers for every single muscle sheet. Go through, type it out, rewrite it, study it, and that's how you'll memorize it. Okay. If you have any questions, please reach out to me. This is our final week of the bulk of content, and the next week we're going to review the lower extremity and the trunk, and then take our final exam. And that'll be the conclusion of our semester. So, as always, reach out to me if you need help. If you have any questions, I'm around. All right, take care.